Just how good is that Medicare Advantage plan when you get a cancer diagnosis? Now, one thing that you'll need to know is, and this is not me saying this is Harlan Levine, the CEO of City of Hope, which is formerly known as Cancer Treatment Centers of America. He says you will never hear a Medicare Advantage plan say, we have the best cancer treatment program out there. Now, that's something to think about. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. All right, let's talk about cancer. I've talked about cancer on other videos, but it's time for me to talk about it again. And some of the other videos I may have mentioned, I'm kind of an expert on cancer because my wife's parents, mother and father, her brother, several of her aunts and uncles all died of cancer. So I've been exposed to this through her over the last 20 plus years. And I'll tell you, it's not a fun thing to watch when somebody else is going through it. But some things you need to know: over half of new cancer diagnoses occur after age 65. And the most common types of cancer are lung, rectal, breast, and prostate. Cancer patients are 2.5 times more likely to file bankruptcy and 80% likely to die. Now, the cancer treatment, the death rates on some cancers are definitely coming down, and some cancers are also easier to treat if they catch them early. But there's some things you need to know about Medicare Advantage plans. Medicare Advantage plans have a lot of sizzle to them. Low premium or no premium. Some of them include dental and vision and even grocery benefits. And they talk about their low copays. Well, yeah, but you need to understand that those are things that are, as long as you're in pretty good health and you're only going to the doctor for checkups and so forth, the Medicare Advantage plan is going to look pretty good. But how good is it when you're going to the doctor, going to 2 or 3 or 4 or 5 doctors every month, and you've got copays of $30, $40, $50 or more every time you go to the doctor? That adds up. So those plans with no premium can actually become very, very expensive, especially when you have cancer. Also, the Medicare Advantage plans typically have small networks. Now, again, this is not me saying this. This is stuff that I've picked up from qualified sources. Hospitals in the Medicare Advantage networks typically have surgeons lacking experience for advanced surgical procedures. And if you're one of those snowbirds, the one that lives up north and come down south for the winter, you may experience out-of-network problems. Prior authorization. This is a big, big thing. One study revealed that a patient was denied an MRI to determine if a lesion on an adrenal gland was malignant. Now, they had to go through an appeal, and on appeal, the company finally said, okay, we will okay an MRI, but they really didn't want to do that. There's story after story after story of people who are being denied coverage. Coverage is being delayed because of prior authorization with a Medicare Advantage plan. I will tell you, when you're sick with anything, but especially cancer, the last thing in the world you want to do is be fighting with an insurance company in order to get things done that your doctor said needed to be done. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.